distinct biological roles that complement each other in the process of conception. Therefore, when infertility arises, it is typically due to issues with the function of reproductive organs, which differ between the sexes.
Understanding the risk factors of infertility will help you and guide you through the process.
So the causes for infertility in a woman can be divided either to hormonal issues or either anatomical issues. So the first common hormonal issues, the most common is called a condition called hormonal imbalance, which is called polycystic ovarian syndrome.
Secondly, the causes can be reflected back to the patency of the fallopian tube. If the tube is closed or restricted, the sperm are able to swim to reach the ovum. So one of the causes is a history of pelvic inflammatory disease and also a history of STD, for example gonorrhea, chlamydia, and also ruptured ectopic pregnancy, or we have the ruptured appendicitis, right? So this is one of the reasons why the fallopian tube can be closed.
Need healthy ovaries, a healthy uterus, and healthy fallopian tubes to conceive. Any disruption to these reproductive organs can lead to infertility. Irregular menstrual cycles can hinder ovulation, the process by which an egg is released from the ovary for fertilization by sperm. Several conditions can disrupt ovarian function, including polycystic ovary syndrome, PCOS, the most common cause of infertility, diminished ovarian reserve, which refers to a lower number of eggs in the ovaries than expected for a woman's age, damage to the hypothalamus or pituitary glands, which can affect hormone production, leading to abnormal ovarian function, primary ovarian insufficiency or premature menopause, a condition where the ovaries fail to function properly before the age of 40, damaged or blocked fallopian tubes due to infection, as well as abnormal uterine structures from growths or tumors, also increase the risk of infertility.
Infertility in men includes several factors. For example, if there's any disruption in the testicular or ejaculatory functions. So, for example, a person who have a history of trauma on the testicle can also causing the sperm production to be much more reduced.
So the number one issue with male infertility is actually they have problems either premature ejaculation or they have erection issues, which is a very taboo subject in our society. So, and not many men will come forward with that problems, and it can easily be treated with the right medication.
Infertility in men can arise from disruptions in testicular function, ejaculation issues, as well as hormonal and genetic disorders. Factors affecting testicular function and ejaculation include varicocele, which is the enlargement of veins within the scrotum and can affect sperm count and morphology. Testicular trauma, which also impacts sperm production. Cancer treatments such as chemotherapy, certain radiation therapies, or testicular surgery, which can reduce sperm count and impair their ability to fertilize the egg. In addition to genetic disorders, hormonal imbalances due to the damage to the hypothalamus and pituitary glands contribute to sperm depletion or loss in men.
The common risk factor that's shared between both men and women that can cause infertility, number one, of course, is age. So women, we are going to see a rapid decline after they reach the age of 37. This is due to women have a certain amount of eggs that they can able to produce in their whole life, and they're only able to release in this period of time, which is what we call childbearing age. So once they pass that age, we call it menopause, and they no longer produce more eggs, so they cannot fertilize anything. So in men, we're able to produce sperm throughout our life. But the trick is, at the end of our life, and the more mature that we get, the lower the quality of sperm that will be produced. So men can produce throughout their life, but women cannot. So we have to catch the golden period of time to create a baby.
One of the reasons why a patient cannot get pregnant is also the problems with their fallopian tube. So fallopian tube naturally is supposed to pick up the eggs from the ovaries, and it should transport the eggs through the fallopian tube, right? But however, certain conditions such as infection, adhesion, or abnormal fallopian tube will cause the fallopian tube to not function as normally. So it can cause patients to, it's called blocked tubes, and thus non-functioning tubes will result in the patient unable to conceive naturally.
Most infertility risk factors are common to both men and women. Women's fertility declines with age, particularly after the mid-30s. Similarly, men's fertility also declines after the age of 40. Smoking is a major risk factor that reduces the chances of pregnancy and negatively affects infertility treatments. Alcohol consumption lowers the chances of conception and poses risks to the unborn child during pregnancy. Being underweight, particularly due to eating disorders such as anorexia and bulimia, is another factor contributing to infertility. Physical inactivity leads to obesity, which increases the risk of infertility. Meanwhile, frequent high-intensity exercise may disrupt ovulation in women who are not obese.
Carrying extra weight or having more body fat can increase the risk of infertility. Based on the National Institute of Health, a woman with a BMI of 35 and above has lower chances to get pregnant compared to those with a BMI of 25. What about men? Every 10 kgs that a man gains will reduce 10% of the fertility rate. Not only that, it can also affect the quality of sperm and change the structure of the sperm.
When we're talking about obesity and infertility in female, we are talking about their regular cycle, we are talking about the hormonal level. So because obesity, they can directly cause imbalance of the hormones. For example, too much of androgens, too much of estrogens, and too much of leptins. So all this, they can cause imbalance to their hormonal cycle.
So there's a recent actually article that came out that shows that Malaysia is actually number one country of obese men and women in Southeast Asia. So that is actually a direct result of our daily habits. Alright. So more and more, and even in my clinic, I see lots of obese women having issues with infertility. There is the obesity in women and also men, right, causes direct problems with the hormones.
So another thing I want to point out is also obesity and weight gain can directly affect to your ovulation. Sometimes if you have this obesity, your BMI is too high, sometimes you don't have any menstruation. When you don't menstruate, you don't ovulate. When you don't ovulate, there's no eggs